And Tynette Deveaux, who's CAPE's Regional Program Manager and Regional Coordinator from Atlantic Canada, is going to be leading us through these.
Thanks, Melissa. Hi, everybody. So I'm calling in today from Unama'ki, Cape Breton. And I'm basically just going to introduce our presenters as we go along. The first presenter is going to be Dr. Laurette Geldenhuys, who's presenting for Nova Scotia. And then I'll introduce others as we go along. So
Great.
Skylar, if you wouldn't mind, that's okay. Skylar, if you wouldn't mind advancing to Nova Scotia first, and then we'll go on to Newfoundland. Thank you. Go ahead, Laurette.
Thanks so much. Can you hear me okay?
Yes.
Great. Okay, so in Nova Scotia, a lot of our energy has been focused on pushing back on the Houston government's decision to reverse the bans on fracking and uranium exploration and mining. Some of our successes included an anti-uranium rally, where we addressed a crowd of more than 500 people at a rally outside the Nova Scotia legislature and played a key role in bringing anti-uranium petitions signed by more than 7,000 people before the legislature. Regarding media coverage, we had great media coverage, including over 20 articles, TV and radio segments, submissions or presentations to the government on fracking, uranium mining, the Traffic Safety Act, bike lanes, electrifying school bus fleets, and protecting urban wilderness areas. KPNS is well represented in the province's Physician Association, Doctors Nova Scotia, and is actively engaging with the Doctors Nova Scotia leadership on planetary health. The Nova Scotia Health Central Zone Sustainability Committee, created by physicians within KPNS, now has funding to hire a project manager for 1 year to support diverse green healthcare projects. And very briefly, while we're on the topic of green healthcare, there are several physicians within KPNS who are actively involved in creating guidelines, implementing guidelines on the not only local but national and even the international level. So KPNS is very active, not only in advocacy, but also in green healthcare. And thank you for CAPE's support for all our activities. We've reached over 1,000 people at town hall meetings where we presented on the health risks of uranium mining and our fabulous fact sheets. Thanks again, Kate, for supporting us to have those professionally produced. And the media coverage and the coalition working on various issues engaged thousands more. Thank you very much. And thank you for Tynette for all your support. And thank you to Kathy and Kristen, who are pillars of KPNS. They are present online at the moment, I think. Thank you very much.
Great. Thank you, Laurette. And although it doesn't fall within this year's time frame because it happened in October, Dr. Chervin, Kathy Chervin, along with KPNS, were instrumental in tabling the second largest petition ever in Nova Scotia, with 7,000 signatures against uranium mining. So thank you for that. And the battle will continue. All right, next we're going to go to Newfoundland and Labrador and Dr. Samantha Pomroy.
Hi, everybody. I'm coming from the west coast of Newfoundland today, on the traditional lands of Mi'kmaq peoples and Beothuk people. So thank you for having me. Our committee was started, I believe, in 2021, and I joined in 2022, so still relatively early days. I'm going to just read a bit about what we've done this year and highlight a couple of challenges and things that we're looking to do going forward. So this year, our major actions were in drawing public attention to local health impacts of climate change and supporting Newfoundland and Labradorian physicians through a catastrophic wildfire season. It was really bad in Newfoundland, particularly on the island this year, with a lot of inhabited areas that were burned. So we had multiple physicians participate in a CBC radio panel and phone in, specifically about how climate change is impacting health in Newfoundland and Labrador. And also I participated in an interview about extreme heat events. So some of that information was then used in a podcast through CBC as well, through the Signal and the This is Newfoundland and Labrador podcast. So we had multiple media engagements. The other thing that Tynette and myself did earlier this year was consult with leads for the Newfoundland and Labrador Health Services environmental sustainability strategy work. We're still waiting on the report to come out from that. It was due to come out earlier this year, but we had a change in provincial government in the fall, and so it's still not out yet. So hopefully that will be on the go soon. We've also had strong engagement with the Memorial University Medical School student population. So this year we sponsored some orientation week events, and we helped put on the Green Week through the MUN Planetary Health Interest Group. So we helped sponsor some various events through that. We also have done multiple presentations on planetary health to MUN medical students and residents. And I also did a webinar for the Canadian Federation of Medical Students, their health and environment focus group. Some of the issues that we've had and like some of our challenges as a group are retaining, well, not necessarily retaining, but recruiting physicians that are able to actually make our meetings and kind of get our group growing. It tends to be a pretty small group when we meet monthly. So we're hoping in the year going forward to increase our engagement and our volunteer base. We do have really strong support through the medical school from medical students. So that's really encouraging to see as well, that the incoming generation of new physicians is involved. And we're hoping to do some work in the coming year on PFAS in the province, because that's been an issue in the last couple of years. It's been in the news. And yeah, we have an upcoming event next weekend with the MUN Planetary Health Interest Group as well. That's a kind of a Saturday morning seminar on planetary health crises. So that's most of what we've been doing in the last year and what we're hoping to do in the coming year. And thank you for all of the support. Particularly thank you to Tynette. We couldn't do it without you. So thanks again, and have a lovely rest of the AGM.
Great. Thanks very much, Samantha. Okay, next we have Dr. Renée Turcotte, who is the chair and founder of Cape Nouveau-Brunswick. Bonjour, Renée.
Bonjour tout le monde, merci d'être là. Je vais parler en français. Fait que juste changer votre traduction. On a eu beaucoup de défis par rapport aux énergies fossiles, le développement des énergies fossiles, de la fracturation hydraulique. Fait qu'on a fait une campagne préélectorale contre la fracturation, axée sur la santé puis les effets de la fracturation contre la santé lors des élections provinciales l'année passée. Nos élections se sont passées en octobre. On a fait aussi beaucoup de couverture sur les impacts de la santé de la fracturation, comme je disais. Là, on a eu une forte visibilité dans les médias locaux, tant en anglais qu'en français. Aussi, on a soumis une lettre ouverte sur cette question au gouvernement provincial sous le premier ministre Higgs. Et nous continuons de tenir le gouvernement sous la première ministre Holt, responsable de l'expansion des combustibles fossiles. On a participé à des rallyes devant l'Assemblée législative le jour de la Terre. On a participé aussi lors de l'ouverture de l'Assemblée législative le 20 octobre à un rassemblement pour combattre l'installation d'une nouvelle centrale au gaz proposée par une compagnie américaine Pro-Énergie, une centrale de 500 mégawatts. Aussi des recommandations pour la mise à jour de la loi sur l'assainissement de l'air. Maintenant, on travaille aussi à faire des recommandations sur la loi sur l'assainissement de l'eau. en partenariat avec le Conseil de conservation du Nouveau-Brunswick et aussi Poumon Nouveau-Brunswick. La section du Nouveau-Brunswick de l'AQME soutient activement la loi provinciale qui garantirait le droit à un environnement sain. On est présent lors de la déposition du projet de loi et lors des lectures, des différentes lectures, mais comme le gouvernement a changé, la loi devra être déposée à nouveau. Maintenant, nous sommes très sollicités comme partenaires de la coalition et pour présenter des conférences, nous avons réalisé bon nombre d'activités favorisant l'engagement public à des événements, des rassemblements organisés par la coalition, à l'Assemblée législative du Nouveau-Brunswick, des réunions publiques sur les campus de l'École de médecine. On a deux campus, un à Saint-Jean qui est un satellite de Dalhousie University, puis un à Moncton qui est un satellite de l'Université de Sherbrooke du Québec. Et puis, on travaille à maintenant à continuer à combattre contre le développement de la centrale d'énergie au gaz et au diesel avec les gens de Tentramar de la région de Sackville. On aura Dr. Popma qui est avec moi aujourd'hui, va faire une présentation demain à un groupe de citoyens pour leur enseigner les effets de la santé, les effets sur la santé de ces centrales. On travaille aussi actuellement avec une communauté de la Première Nation Pescotomukati ou bien Passamaquoddy et la Régie régionale de la santé Horizon sur l'impact sur la santé de la centrale nucléaire de Pointe-le-Trou. Et on a d'autres projets, la mine 600 qui pourrait être ouverte avec les nouveaux projets du gouvernement Carney. Alors, ça sera une autre lutte parmi tant d'autres. Merci beaucoup.
Merci, Renée. And I just want to say too that whenever there's a rally and Premier Holt is around, you'll see Renée right there talking in her ear, trying to make a point to influence the premier. So Renée has been a great advocate for Cape New Brunswick. And hopefully we can get you to do the same with Dominique Leblanc, who I believe is one of your neighbors. So, okay, next I'm going to introduce Patricia Clermont, who is the organizer for AQME and also a spokesperson and media relations person for AQME. And she'll be presenting on behalf of her committee. Thanks, Patricia.
Merci, Tynette. Alors, pour l'AQME, en fait, ça a été une année de vraiment grandes avancées, notamment pour la communauté de pratique pour écologiser le système québécois que l'on a depuis 2023, Propulsion Éco-Soins, qui est financé depuis le début de l'année pour 3 ans par le gouvernement du Québec et qui donc est une communauté de pratique dans laquelle les cliniciens partagent des façons et des avenues pour décarboner le système de santé. On a déjà tenu 2 activités de formation cette année via des webinaires et on va bientôt lancer une plateforme web qui met de l'avant les efforts des cliniciens et cliniciennes dans leur milieu pour décarboner le système de santé. On a aussi une nouvelle vice-présidente à l'AQME qui est pharmacienne et très active dans cette communauté, Geneviève Ouellette, mais malheureusement, elle ne pouvait pas être avec nous aujourd'hui parce que justement, elle travaillait à l'hôpital Sainte-Justine. Et par ailleurs, on a aussi tenu le premier événement en personne de l'AQME à Montréal en mai dernier pour célébrer le 30e anniversaire de l'AQME. Ça a été très apprécié et l'occasion pour beaucoup d'apprendre que l'AQME, avec un Q, fait partie de l'AQME avec un C de Cape. Donc, par ailleurs, il y a des participantes engagées à l'AQME qui sont de plus en plus à l'aise et sollicitées dans les médias québécois à la suite de Claudel. Des nouvelles venues aussi au comité qui proposent des dossiers et des comités de travail qui fonctionnent très bien, comme en témoignent par exemple les recommandations de l'AQME pour des plans climat des villes que l'on a lancés en juin dernier. On continue aussi notre travail afin que le cadre de référence sur l'air qu'on a lancé en 2024 devienne ou participe à établir une stratégie nationale de l'air sain en parlant particulièrement avec des partis d'opposition à l'Assemblée nationale. Et par ailleurs, Santé planétaire, prescription médicale pour un environnement sain, le livre écrit par la docteure Claudel Pétrin-Desrosiers, la présidente de l'AQME, qui reste présidente de l'AQME, a obtenu depuis son lancement, un très bon succès, puis il est maintenant aussi distribué en Europe. Justement, elle n'est pas avec nous aujourd'hui parce qu'elle participe au Salon du livre de Montréal qui se tient en fin de semaine. Enfin, l'AQME continue aussi à avoir une très forte empreinte médiatique au Québec avec de nombreuses lettres ouvertes qui sont publiées, des entrevues de différents formats réalisés sur des thématiques chères à l'AQME, notamment en qualité de l'air, en adaptation climatique et plus encore. Et on travaille aussi beaucoup en coalition sur le plan de l'énergie, comme membre de la coalition Sortons le gaz, qui travaille aussi contre l'éco-blanchiment, et comme membre du regroupement des organismes environnementaux en énergie, sur le plan de l'importance des espaces verts et de la biodiversité, du financement des transports collectifs comme membre de l'Alliance Transit et même au niveau fédéral avec la section Québec du réseau Action Climat Canada, CanRac. Et on participe aussi à 2 comités aviseurs, un pour les partenaires de la Déclaration de Montréal sur la pertinence des soins, porté par le Collège québécois des médecins de famille avec Choisir avec soin, et un autre avec la Climat, la communauté des communicateurs climatiques au Québec. Voilà, merci.
Merci beaucoup, Patricia. Okay, next we're moving on to Ontario. And first I'll introduce Anne Keary, who joined our team as the coordinator for Cape Ontario and also Manitoba in May. And she's doing amazing things with her committees. Anne, are you? Yeah, I think she's finding the mic there, and right. she'll introduce her presenters as well.
Hello, everyone. Wonderful to be here for my first Cape AGM. And it is my great pleasure to introduce first Dr. Mili Roy, who is one of our co-chairs of the Cape Ontario Regional Committee and is doing fantastic work alongside Sejal. So we are very blessed. Take it away, Mili.
Well, thank you. And of course, we are very blessed to have you. And at Cape Ontario, we're so lucky. So thank you. And I will try to give you a little bit of a summary of what Cape Ontario has been up to. And we have a lot going on. So first on our list is work with extreme heat awareness and actions, which we really elevated to an equity issue. So around this, we have published op-eds. We've been promoting access to a provincial program for air conditioners to be prescribed by physicians and healthcare workers for residents on social assistance. And this has been done in collaboration with HPAP, Health Providers Against Poverty, which Dr. Green is quite involved with, and the Canadian Environmental Law Association, and raised the issue of heat in a joint letter to the Toronto Board of Health, urging them to sort of address this in an upcoming healthy school strategy. We've also been advocating for municipal climate action plans. We have a December action plan with the City Council in Toronto. And discussions with the Mississauga Municipal Advisory Group, and presentations to support maximum heat bylaws in Kingston. We have, as an RC, generated a lot of media attention, some of it around health impacts of gas plants in Toronto, which is an ongoing project for us. Also in Thunder Bay, we've got great representation and activity, and other municipalities. And these have attracted television media, radio interviews, print media, for the Portland Energy Center gas plant in Toronto. We've had reports in the Toronto Star, CTV News, CBC Radio, in Radio-Canada. And extreme heat events in Ontario. generates more interest in maximum heat bylaws, and again, leads to more media. We have also submitted comments concerning the threats to Indigenous rights and environmental laws, also around green building standards posed by the Ontario government's recent legislation. And then we've also done a lot of work around public speeches, rallies, demonstrations. We have had several town halls that Cape Ontario members have been involved in, as well as rallies, often working with partner organizations around climate and health. And one example was the Healthcare Not Highways rally against a large highway project that's proposed in Ontario, Highway 413. And I was happy to see our work actually featured in a recent Environmental Defense Appreciation Dinner where they were highlighting their highlights of the year, and Cape was featured. We have done town halls opposing gas plant expansion right in Toronto, again at the Portland's Energy Centre. Likewise, presentations to Thunder Bay Council, where there's been gas plant expansion proposed, as well as in Sarnia. So multiple municipalities around Ontario, unfortunately, are still trying to do gas expansions. In terms of public rallies, we participated in the September 20th Draw the Line event, which was really part of a global action. We actually were helping to amalgamate all healthcare sector that was marching at the request of the entire march organizers. We did cabling on behalf of Cape. It's a long list here. Really, Cape Ontario's perspectives on health and climate really are getting good recognition. And I would say that we've also been active in supporting much of Cape National's work. So we have been helping support the fossil fuel ad ban. We supported the Planetary Health Day of Action on October the 6th. We've also been involved in the Meet the Moment campaign, which are all federal. And I'm happy to say that we continue to work in collaboration with many other great partners that really increase the impact of our work. Thank you.
Thank you so much. Thank you so much, Mili. Cape Ontario is doing amazing work on so many different fronts. And next up is Cape Manitoba, who are a small but mighty team. And we are going to be hearing from a core member of the Cape Manitoba Committee, Dr. Scott Blyth. So, Scott, over to you.
Yes, thank you very much, Anne. And I'd like to echo, hopefully everyone can hear me. I'd like to echo Cape Ontario's statement about how much Anne Keary has helped us with our work, and it's been wonderful having Anne Keary involved as our coordinator. If I can just read from a report from Cape Manitoba. Despite having a relatively small active group, we at Cape Manitoba feel that we had a year where inroads were accomplished. As a group, knowing the vast number of opportunity for getting involved with all sorts of different campaigns or projects, we decided to narrow down and to focus on three main areas. They are decreasing greenhouse gas emissions in healthcare facilities, active transportation and the lobbying for more infrastructure, and the third one is the importance of trees and forests and tree canopy. We also have a member who is championing decreasing or ending the use of greenhouse gas agents in the operating room. These include the anesthetic desflurane, single-dose metered inhalers, and nitrous oxide. In regards to trees and forests, we had a big win in regard to our involvement with preserving it's called the Lemay Forest in Winnipeg. This stand of trees had a large historical, cultural significance to our Indigenous community, as well as being a green space. It went from being planned to be cut down to now being newly designated as a provincial park. We have also been working with a local group, Trees Please Winnipeg, who are trying to make people aware of the importance, especially health benefits, of tree canopy. In regards to active transportation, one of our members has been attending numerous City of Winnipeg Council meetings to speak to the need for more biking infrastructure. She is also looking at ways our municipalities and small smaller towns can benefit from bike infrastructure, both locally and developing a connectivity between the smaller centers. During a recent bike week, we set up 2 pit stops on the route. We also had Patty Weens, the chair of Bike Winnipeg, give us a presentation to our group. Another of our campaigns involves looking at ways to decrease greenhouse gas emissions in buildings. As we know, 13% of all greenhouse gas emissions in Canada originate from buildings, and our campaign was more specifically directed at healthcare facilities. These are all public buildings. And I guess basically this means to eliminate the use of natural gas for heating and cooling. We ended up having a meeting with the provincial minister for the environment and climate change, at which time we gave presentations in all 3 of our interest areas. Our ask in regards to greenhouse gas emissions decreasing was to have the government announce a plan to retrofit 10 public buildings, and number 2, for any new buildings to not have natural gas connections in them. They did announce a plan to subsidize 5,000 homes in Manitoba to change to ground source heat pumps. We had a second meeting with the Deputy Minister of the Environment and Climate Change, and again brought up our 3 main areas of interest. Our asks for the greenhouse gas emissions were to have the provincial crown corporation called Efficiency Manitoba become better funded to increase the rate of electrification, things like heat pumps, electric furnaces, and electric boilers, and also to have decreasing greenhouse gas emissions as part of their mandate. Some other notable events we were involved with was meeting with a fellow named Michael Pereira, who was responsible for health policy with the Department of Health, Seniors and Long-Term Care. We spoke about switching to more plant-based menus in hospitals and trying not to send much food waste to the dump. We had a meeting with
I'm just going to jump in for a second, Scott. We're at time there. Can you just maybe highlight one more thing and then we'll go to the next one?
Yeah. We did have a meeting with a woman named Heather Acton. She's been hired by the Department of Education to look at climate change education in our school system, K-12 curriculum. Certainly is a lack of good climate change education here, and where we were able to present CAPE's interest in knowing about the fossil fuel industry influence in the school curriculum, and also getting, as part of the health part of the curriculum, environmentally related health issues that we all we are all aware of. We had a number of op-eds, and we're recently seeing that there's a plan to build a carbon capture plant in Western Manitoba, which we're hopefully battling against. Anyway, overall, I think we can feel happy with our achievements for this year. Our biggest challenge is in the area of recruitment, and in particular, trying to make contact with medical students. I'm sorry, running way over time. Interesting, from our meeting with Heather Acton, she made us aware that this summer we had a lot of smoke from wildfires, but she mentioned that from her work, she notes that most Manitobans do not make the connection between climate change and the wildfire smoke, and most Manitobans have not made the connection between climate change and the fossil fuel industry. So sounds like a lot of work to do. Anyway, thank you so much for allowing me the extra time to go through all that. And once again, thanks so much to Ann Keary for helping us with our work.
That's great. Thank you very much, Scott. And I'll just point out that I know each committee is doing such amazing stuff, and we won't be able to get through it all in this call. But one of the ways we can be sharing this information with each other now is with the CAPE newsletter. So, it just relaunched thanks to Megan's fine work. And I would encourage people to share these things with your coordinators, and we can funnel it to Megan for the newsletter. So our next, I'm going to introduce Rhiannon Fox, who's the coordinator for Saskatchewan, Alberta, and British Columbia. And I'm sure you have a lot of fans in those committees as well. All right, over to you, Rhiannon.
Thanks, Tynette. I'll try to be quick with my introduction since I know we're over time. We'll start with Cape Saskatchewan, which is another small but mighty committee punching above its weight. So I'm happy to introduce Sabahat Saeed. She's a fourth-year medical student at the University of Saskatchewan. She just stepped up to become co-chair earlier this year, along with Dr. Murray Opdahl. Sabahat, over to you.
Thank you, Rhiannon. Thanks for the introduction. My name is Sabahat. I'm a fourth-year student. So I'll just kind of go over our three main achievements, and then I'll talk a little bit about the challenges and what our plans are kind of for the future. So in Sask, one of the big things that we've been involved in is opposing coal-fired power. So we did this in a couple different ways. So we were involved with the Citizens for Public Justice who were challenging the Sask government's decision to extend coal power in Saskatchewan. So we presented a webinar on the health impacts of coal power in Saskatchewan. Our co-chair, Murray, also published an opinion piece in the Saskatoon Star Phoenix on the negative impacts of coal-powered electricity on health as well. So that's kind of how we've been involved in that. Our next thing would be our policy recommendations and op-eds. So we submitted some policy recommendations and published op-eds on building standards and coal phase-out, which I kind of talked about. Earlier this week, we just submitted a commentary on the City of Saskatoon's budget, opposing cuts to programs that were supporting climate and public health. So we're kind of excited to see where that's gonna, hopefully somebody out there listens to what we have to say and it hits home to some people. And then our next point here was we participated in 3 events that were hosted by partner and NGOs on the health impact of wildfire smoke, the health risks of coal power in Saskatchewan, and the health benefits of ecosystem protection in Saskatoon. I think, am I missing anything else on here that I want to mention? Yeah, so earlier this month, we were involved in a community cleanup event, which is pretty amazing for its turnout. We were able to recruit several med students to come join, as well as students from other colleges to come join us as well for the cleanup. I think that's something that we've been struggling with, trying to recruit medical students and recruit physicians. So we're trying to actively work on that by, in our last meeting, we were discussing adding some of our flyers that we have into the physician meeting rooms in the hospital. So we're in the operating theaters and similar areas to try to get our name out there and try to recruit more physicians. Our co-chair at the moment, Murray, he's been involved in Cape Saskatchewan for about 7 years now. And I think he's ready to step down. So we're having a bit of a hard time figuring out how we're going to replace his role. So we're trying to recruit another co-chair as well. So that's been one of the big things that we're working on this year. And then our other plans kind of for the future, we're working with the SHA to try to switch over to reusable gowns in the operating room, because Saskatoon still uses mostly just single-use gowns. So we're trying to switch over into the reusable gowns. We're just starting the discussions around that and hoping to make some more progress in that area later this year. Yeah, I think that's kind of everything that I had. So just move on to the next group then.
Thank you, Sabahat. Next up is Cape Alberta, and Dr. Julia Sawatzky will be presenting. She's an emergency medicine resident physician based in Edmonton and is one of 2 co-chairs along with Dr. Steve Wilton. Julia?
Awesome. Thanks, Rhiannon. And hi, everybody. So I'll jump right in with some of our accomplishments from Cape Alberta this year. It was my first full year as a co-chair, which I really loved. And Steve Wilton, who I don't think could be here at the moment, has been a huge mentor to me in that. So we had film screenings of Plastic People in Edmonton and Calgary this year, which were big highlights for us for multiple reasons. They were the first in-person events that Cape Alberta hosted in a while, kind of since the end of pandemic restrictions, or as long as I've been part of the committee. So we got to connect with each other, which was super exciting. But then also these events connected us to Cape National's work, so to the work of the Toxics campaign, the 30th anniversary campaign, those celebrations. And then it also helped us to feel connected to other regional committees that were hosting similar screenings across the country. But then at the same time, we were able to make it local, and we brought together scientists and advocates who were looking at the impacts of microplastic pollution in our own lands and watersheds, and what health impacts that was having. And then also people here in Alberta who are really engaged on plastic solutions. So yeah, that was a really some big highlight events. Second here, we have our media presence. Rhiannon Fox, as so many people on this call will know, is amazing in so many ways, but has been a real powerhouse for connecting us to media opportunities, helping us to write and place op-eds, and really connect our content to relevant current moments and events. One of our challenges in Alberta that I know is not unique to Alberta is just a constant onslaught of bad climate news. And she has really helped us be like, this is a moment to speak up. This is where we can add the health lens. So we've talked about coal, methane regulations, mature assets from oil and gas companies, tailings ponds, oil sands, air pollution, AI data centers, and more. And then finally, we've been able to attend a lot of community events, primarily in Edmonton and Calgary, but we also have really strong active members in Canmore. I think Suzanne is on this call, and Lethbridge, who punch above their weight representing us. And we really try our hardest, even when we're stretched, to show up at events that other groups invite us to. Because we find that some of the work that's harder to measure that CAPE does is like face-to-face, one-on-one conversations, people in community, whether that's the general public or other healthcare providers or people from other ENGOs, or people who haven't thought about climate and health at all yet. So thanks so much, Rhiannon, and everyone who's here from CAPE Alberta for all your work this year.
Thank you, Julia. It's such a joy to see your enthusiasm and optimism. Thank you. Thanks very much. And let's, last but not least, move on to CAPE BC. Our co-chairs are Bethany Ricker and Kevin Liang, and neither of them is able to present today. So Dr. Julia Robson will be stepping in to present on behalf of CAPE BC. Julia is an emergency and family medicine physician in Campbell River, living and working on the unceded territory of the Wiiwetkai and Wiiwetkum nations. So over to you, Julia. Other Julia.
Hi, everyone. So I'll talk first about our work exposing the healthcare costs of LNG. So lots of media attention for CAPE BC about the health and healthcare costs. Specifically, we had a press event on September 8th, which I know is a little bit outside of the fiscal year, but forgive me for that, about protecting health from LNG. And then specifically highlighting the fact that physicians are actually leaving communities because of health concerns, and just really highlighting those specifics. We also had an op-ed in the Vancouver Sun from Dr. Meyer and Dr. Takaro on the health harms from LNG. So just really drilling down, no pun intended, on those specifics about the health harms that we're seeing. We also had an open letter which was signed by over 300 healthcare professionals on that topic. Second of all, we submitted letters around various topics. So one of our big wins from the year was in November 2024, when Vancouver City voted in favor of maintaining the methane gas ban in new homes. And specifically, they mandated clean electric heating and hot water in new buildings. So that was a good project for CAPE BC this year. We also submitted many letters about fracking and LNG, thermal coal exports, active transportation, safe streets, and green space expansion all over the province. And then finally, we collaborated on many events, so a few to highlight: collaborations with ENGOs and Indigenous communities, webinars, film screenings, panel discussions, to name a few. And then on the theme of direct action, which we were speaking about earlier with our fantastic panel there, we attended Draw the Line on September 20th and had quite a good CAPE BC contingent there, and participated with the many groups there. And just really showing what collective action can do. And then second of all, we have attended lots of Connect the Dots town halls, really engaging the community on with Frack Free BC, on just speaking with community members on what we can do and why it's important to move away from fracking. And then just recently, our team has been engaged in a filibustering effort with the Vancouver City budget, which has been unfortunately trying to eliminate the city's climate and sustainability office, and just really undoing decades of progress on planetary health. And so our team has been engaged in both letter writing and attending council in person. There's over 600 folks, not only from Cape BC, of course, but who have signed up to speak on that. So it's been a great year and looking forward to the next one. Thanks, everyone. And also shout out to Rhiannon, who I'm pretty sure does the job of about 4 people. So much appreciated in keeping us all engaged this year. Thanks, everyone.
Thanks so much, Julia. I also just want to very quickly mention and give kudos to Dr. Larry Barzilai, who served as Cape BC chair for about 10 years, did an incredible job, founded the committee, and helped build it into what it is today. And also thank Bethany and Kevin for stepping up to relieve him, because it was time for him to have some well-deserved rest. Back over to you, Tynette.
Although knowing Larry, I'm sure he'll find other things to keep him very busy. Well, thank you very much, everybody. I'm sure you can see from these presentations that we have an awesome team of coordinators, and we have fabulous physician volunteers in the regions doing amazing stuff. And it's really an honor and a privilege to work with these folks and with all the Cape staff, and look forward to continuing on with you for many years. Thank you.
Thank you so much, Tynette, and all the regional coordinators, Anne and Rhiannon. I would say that our efficacy as regional committees has exponentially increased since you all came on board, and we are so grateful for the work that you do. We would not be the committees we are without you, so thank you. We